Hi, today is gonna be a different sort of video, but still mental health related. As some of you may know, I'm a chronic illness therapist because I have lived with chronic illness for about 10 years now. And this past week, I had some sort of emergency dental work come up, and I have really bad dental anxiety. So I'm going to talk today about what kind of things I did to help myself get through these procedures. I woke up last week with what felt like was an infection in the last wisdom tooth that I had to be removed. Now, I totally avoid going to the dentist because of my dental anxiety, but it hurt so bad I felt the urgency, and so I made an appointment to go in and do a tooth removal, which I was already nervous about. When I got there, they looked at it and said, "This is actually worse, and you're gonna need a root canal, so you'll have to go to a separate endodontist, and then you'll have to come back and get a crown, a filling in an area that had been decayed, and then have the wisdom tooth removed." So multiple procedures over 2 days with 2 different providers. I immediately talked to that first dentist, who, by the way, was my first female dentist that I had gone to. I don't know why, I just have always been referred to male dentists, and I think that's been part of why I've had a bad experience, because they weren't as nurturing and as compassionate. Just in my experience, I'm not saying all male dentists are like that, but the ones that I've had that have been all male were very rough, let's get this done, and kind of impatient with me. So I immediately informed her of my anxiety. I let them know the things that I do the worst with, which are the x-rays, the bite plates, and the shots, and that I also have a very sensitive gag reflex. So right away they informed me of some options. I also have POTS, and so I had learned previously that the shots have epinephrine in them, which can make POTS worse. So she did let me know there was an option for non-epinephrine numbing, and they also had gas, which had never been offered to me before. Now, having control over some of these options helped, but I still did cry for like 2 hours before my endodontist appointment. I did some brain spotting to kind of release those emotions, and that did help a little bit. The things that ultimately helped the most with my anxiety to get me through were them not putting the bite plate all the way in my mouth, using the gas and the non-epinephrine based numbing, and having a nurturing, comforting, compassionate presence.